You're listening to the Conference Board of Canada's Mental Health and COVID-19 series with Dr. Bill Howitt, Chief of Research, Workplace Productivity.
Welcome. My name is Bill Howitt from the Conference Board of Canada. First of all, I'd like to thank very much for Mood Disorder Society of Canada for inviting me to spend a few minutes to give you a couple ideas on where I think about mental health and things to consider as we all try to navigate this thing called COVID-19 and as we start to consider moving forward to work. So first, I'll give you a bit of my background real quick. I've lived my entire life with a mental health issue myself, with anxiety, ADHD, and learning disability. So I have an inside take. I've also seen patients for over 30 years. I have a PhD in counseling psychology and have lots of experience working as a practitioner. So I'm going to give a couple ideas for you to look at this conversation from both a person who's lived their life with a mental health issue and someone who's supported people with a mental health issue, which I think gives me a unique kind of qualification that I understand the challenges of trying to articulate to someone else what it really means to be challenged by a powerful emotion such as depression and anxiety. So they asked me to give you a couple ideas around returning to work, the uncertainty around it. Now, at the Conference Board of Canada, we are doing a daily COVID-19 series called Mental Health COVID-19. Please check out that link. I'm sure on this video, they'll on the bottom be very kind to make sure you know how to get access to that link. Love to have you watch and participate. We speak daily on ideas specifically to give people tools to navigate COVID-19. Now, in regards to my coaching, I'm going to talk a little bit with you today, and I have about 3 or 4 more minutes. And I'm going to talk to you basically about giving you a couple ideas as you start to return to workplace. And I don't say that return to work because lots of us that have been fortunate have been working, some of us been sheltering, and some of us essential workers have been dealing and navigating with the pathogen and the fear and anxiety with that. Okay, so people who been sheltering and returning back to work, there's a certain amount of uncertainty. Now, while we start to see the fine weather and you start to see people release themselves, the thing that's important for us to remember is COVID-19 hasn't gone anywhere. And so if we don't take care of making sure we wear our mask, wash our hands, pay attention to our distancing and be with rigor, we're going to put ourselves at risk. So by taking charge of what we can control first is really the first step we can do to help mitigate our anxiety. However, for the return to work, the mnemonic I'll use for this little conversation today that helps me organize my think is norm. As you start to think about it, the N, there's nothing wrong with you experiencing a little bit uncertainty, anxiety, and worry. That's very, very normal. There's nothing wrong with you. That's because it's an unknown situation. Our brain, when it doesn't have certainty, will run some anxiety, which is a way of us being hyper alert to pay attention. And often once we get used to the situation, what's going on, we'll often calm ourselves and we'll feel better. So it's okay to realize you will have some anxious, and especially folks with a mental health issue. I live with anxiety and I understand that when my anxiety starts to go up a bit, it's really important for me to be doing my diaphragmatic breathing and calming my nervous system and paying attention to what I can do. The O, it's okay to talk to people about how you feel and ensuring we need to do better about expressing your concerns, questions you have, certainties around it. If you're not sure about a PPE, a personal protection equipment, ask questions. Make sure you're clear about the process so you feel comfortable about the reporting of how things are done, policies. It's okay to ask lots of questions. The R is just because you don't know an answer and you get yourself a little bit upset or frustrated or concerned. The big thing I try to tell people with a mental health issue, if you can remember one thing, is when we get caught here, just because we don't know, and when our emotions pull us down, especially depression, if we can anchor in our brain, just because we don't know the answer doesn't mean there's not an answer. And it's okay to be talking to people to help get us up to that part of our brain to get us some support. And the last thing I'm going to say to you, my biggest coaching, I'm going to encourage everybody with a mental health issue or not, get active with a mental fitness strategy. Focus on your daily physical health. resiliency, coping skills, and your social connections. Be active as you can in taking charge of your mental health, because you have mental health regardless if you have a mental illness. We still have mental health, and we confuse these two concepts. So mental health is equivalent to physical health. With that, I'm going to leave you. I'm grateful for the opportunity to share a few thoughts with you. If you ever have any questions or ideas for us at the conference board around research or things we can do to help other people in our community, we have a deep passion for mental health. We're happy to listen and happy to contribute. So good luck with all the good work you're doing. Moon Society, I think keep it up. It's important work you're doing. So thank you for inviting me. Hi, Bill Howard here. Hopefully you're finding these videos of some value. If you'd like to share these, on the lower right of your video, there's a icon you can click. You can send it through your social media feeds, join the Conference Board of Canada social media feed so we can keep you up to date. And if you have ideas, suggestions, please leave your comment so we can consider them. And if you have things that you'd like us to speak to, I certainly will try to do all I can to help out. With that, have a wonderful day.